There is a lack of money for hospitals, which affects the health and lives of patients. So far, the government has no concrete plan to solve the problem. In addition, the supply of medicines is at risk, and nurses are preparing to go on strike. Prime Minister Donald Tusk met with representatives of the National Association of Employers of District Hospitals. The main topic of discussion was the difficult financial situation of the facilities. Ideas on how to fix the healthcare system seemed to be lacking.
Nie wiemy, co się będzie działo dalej.
We do not know what is going to happen. The situation is serious. There is a lack of funds for the safe operation of our hospitals. We are working to solve this problem, but at the moment, there is no ready solution. This year, Polish hospitals may lack up to 15 billion zloty.
Na tą chwilę
At the moment, there are no funds in the budget of the Ministry of Health that would be sufficient to pay especially for limited over-execution. Hospital staff do not hide their dissatisfaction. Nurses are preparing for a strike. On November 19th, in front of the Prime Minister's office, they will fight for a citizens' bill on the future of their profession. We are fighting for recognition of the education that nurses and midwives have to use in their work, to stop the process of degradation and discrimination, to introduce changes, such as allowing career planning and professional development, that will encourage young nurses to enter the profession. Problems are piling up and, according to Izabela Leszczyna, who has been Minister of Health for almost a year, the previous government is to blame. The financial obligations which, again I don't like to say it, but which the Law and Justice government has imposed on the National Health Fund in no way correspond to the actual funds and revenues from the contribution. Moreover, one gets the impression that the current government does not want to invest in the production of drugs in Poland. Izabela Leszczyna scrapped plans to announce a competition for Polish pharmaceutical companies, the idea being to allow Polish companies to produce medicines that will be useful in a crisis situation, such as a war. Today, Poland relies heavily on importing medicines from abroad. Prime Minister Tusk's government prefers to buy medicines for a rainy day from foreign suppliers rather than investing in Polish companies to sell them. The Together Party highlights the problems facing healthcare. One of the key conditions for the Together Party to support the 2025 state budget is the issue of increasing healthcare spending by more than 20 billion zloty. This is the minimum for this system to function at all. Does the government of Prime Minister Tusk have a plan to solve the problems of the healthcare system? Will we hear again that there is no money and there will be no money? Everything has to be done in dialogue with the environment and stakeholders, such as patient organizations. And secondly, there has to be a very systemic view of the problems of healthcare, and it can't just be based on putting out fires as they arise, but there has to be a certain holistic vision. Poles expect the government to solve the problems of healthcare, not blame its predecessors. Healthcare is an issue that should be excluded from political disputes.